today's webinar. This is our fourth and final webinar with FASAP talking about clinical depression. A few key housekeeping items here before we get going, just serving as reminders. This webinar will be recorded, so just being mindful of anything that you share during the recording. It will be saved in the recording as well. We do have everyone on mute currently. There will be an opportunity at the very end to share any questions or comments or anything in the chat feature, which is the very bottom kind of option there on your menu, on your GoToTraining menu. So feel free to shoot us a comment or a question at any point in time, and we'll take time to answer those at the very end as well. Just as a note, you can send the chat to just the organizers or to everyone. So again, just being mindful if it is any sensitive information or anything along those lines, to just send that just to the organizer. Without further ado, we'll get started here. We have Frances Callahan with FASAP here, and she will be taking over and walking us through the slides this afternoon. And
all right, thank you, Liz. Hello, everybody. Looking forward to speaking with you today about clinical depression, about how to identify it and prevent it and treat it and ameliorate the worst effects of it. Just click on that. Okay.
Yes, there you go.
All right. So today we're going to talk about first how to recognize the signs of clinical depression in yourself and others. So we're going to talk about exactly what clinical depression is. And do keep in mind that there are several synonyms that are commonly used for clinical depression, including major depression. And that doesn't mean necessarily more severe depression than other kinds of depression. It just refers to this clinical diagnosis of depression, also known as clinical depression or depressive disorder. So we're going to talk about how clinical depression is different from sadness or the blues. Then we'll talk about treatment options for clinical depression and self-care strategies that may help prevent depression and aid in recovery. So what is clinical depression? First, you should know it differs from low mood and the kind of blues that most of us experience from time to time, perhaps all of us experience from time to time, that kind of low mood that's sort of part of just being a person. With clinical depression, the effects are deeper and more pervasive. They affect our ability to feel, think, and handle daily activities. And key is that in order to be diagnosed with clinical depression or an episode of clinical depression, your symptoms need to be present every day for at least 2 weeks. And those symptoms always will include low mood most of the day and loss of interest in normal activities and relationships. There are a scatter of additional symptoms that may accompany the low mood and loss of interest, and those would include loss of energy or fatigue, feelings of worthlessness or guilt almost every day, impaired concentration, indecisiveness, difficulty sleeping or excessive sleeping almost every day, markedly diminished interest or pleasure in almost all activities nearly every day, noted by self or others. So family members commenting that you seem different is something to take note of. You might also feel restless or slowed down. So on the one hand, jittery and unable to settle, or on the other hand, kind of a sense that you're almost moving through molasses. Every movement takes more energy than you feel like you have. Some people will experience recurring thoughts of death or suicide when they are depressed. And that even is aside from any intent to take one's own life. There just may be sort of images that come into your mind that would be associated with death or suicide. And some people also experience some significant weight changes. That's going up or down in weight by more than 5% of your body weight within a month. It's important to note that depression is not a sign of weakness. It is a real illness. It's not a sign of a person's weakness or a character flaw. You can't snap out of clinical depression. Most people who experience depression need treatment to get better. Now we'll talk a little bit about what causes depression. Generally, there's a combination of risk factors that come together to cause an episode of depression. Those risk factors can include genetic factors, so we do know that people who have a family history of depression may be more likely to develop clinical depression themselves. And then environmental stressors that come in contact with the genetic factors and produce this clinical depression. And some common environmental stressors that contribute to depression include financial problems, loss of a loved one, although we're going to talk later about grief and how that is different from depression, but certainly grief can contribute to depression. A difficult relationship or a breakup, separation, or divorce. A major life change. Work problems, social isolation or feelings of deprivation, and physical, sexual, or emotional abuse. We also know that depression can occur with other serious medical illnesses, such as diabetes, cancer, heart disease, or Parkinson's. Depression can make those medical conditions worse, and actually those conditions can make depression worse as well. It's also important to note that some medications taken for those and other illnesses may cause side effects that can trigger or worsen depression. Now let's talk a little bit about who's at risk for developing clinical depression. We know that 20 to 25% of adults in this country may suffer an episode of clinical depression at some point during their lifetime. We also know that clinical depression affects older adults, teens, and children, as well as middle-aged and young adults, but frequently it goes undiagnosed and untreated in these populations. Let's talk about women in depression. So we know that almost twice as many women as men experience clinical depression. Hormonal changes during puberty, menstruation, pregnancy, miscarriage, and menopause may increase the risk. And we know that women who are biologically vulnerable to depression may, when they experience increased stress at home or at work, will also increase the risk. And that really also reminds me that any group that is marginalized in any way is also more vulnerable to depression. Depression is also common in men, but it actually may look quite different in a man than it does in women. So rather than expressing sadness, many men with depression will instead seem angry, irritable, and aggressive. They may be more likely than women to exhibit restlessness and kind of being on edge. They may feel tired, flat, and empty, and lose interest in family, work, sex, hobbies. They may engage in high-risk activities like riding a motorcycle really, really fast, or escapist activities such as working all the time. And they may self-medicate with alcohol and drugs. They may be more likely than women with depression to have trouble sleeping, and they may seek treatment for physical symptoms that are actually rooted in mental health disorders, such as headaches, chest tightness, and digestive problems. Let's talk about children and adolescents and depression. Children with family histories of depression and those experiencing stress, loss, anxiety, learning problems are all at elevated risk for depression. Children and adolescents with depression may experience irritability, restlessness, sadness, crying, mood swings, difficulty sleeping or concentrating, falling grades, disciplinary problems at school, or school refusal. They may experience a change in their eating habits. They may express feelings of worthlessness and withdraw from friends and activities. They may experience loss of energy and low self-esteem. And as is the case with adults, as we've already said, they may also experience kind of unwanted thoughts of death or suicide. Depression is common among older adults as well. But it's important to note that it's not inevitable that older adults will be depressed. Although it's true that the life changes and losses that come with aging may cause uneasiness, stress, and sadness, and we know that those feelings can contribute to depression. As with men, though, older adults who are depressed may not exhibit just sadness. They may exhibit fatigue, insomnia, irritability, and in some cases, confusion or attention problems that can make it appear that perhaps they're experiencing Alzheimer's disease or other brain disorders. Some medical conditions may cause depressive symptoms, as we've already said, and we know that as folks age, often they will experience some of those chronic diseases, medical diseases that may contribute to depression, and that depression may worsen. And again, some medications have side effects that may contribute to depression as well. How is clinical depression diagnosed? A health or mental health professional will perform an assessment. The diagnosing clinician might be a primary care doctor, a psychiatrist, a psychiatric nurse practitioner, a licensed clinical social worker, a licensed professional counselor, or a licensed clinical psychologist. Before giving a diagnosis of major depression, your doctor may rule out medical problems with symptoms similar to those of depression. And that's one reason why a good first point of contact, if you're wondering if you might be experiencing depression, is to see a primary care provider, somebody who can look at you in a holistic way and sort of determine whether there may be a medical problem that accounts for some of the things you're experiencing. Once clinical depression is diagnosed, it's time to make a treatment plan. The treatment plan may include medication. A primary care doctor, a psychiatrist, or a psychiatric nurse practitioner may prescribe an antidepressant. Your provider may need to try several different medications at different doses to determine what medicine works best for you. So it may take a little while to get the effect that's needed. It may take a while to figure out which medications work best, and also most of these antidepressant medications may take up to a month to really be fully effective. It's always best, or almost always best, to combine medication with psychotherapy. So in Maryland, the various professions and disciplines can provide psychotherapy. A psychiatrist, a clinical psychologist, licensed marriage and family therapist, a licensed clinical social worker, or a licensed certified professional counselor may provide psychotherapy. Talk therapy can take various forms. It can involve looking at your thoughts and sort of learning new ways to think that will therefore affect new ways of feeling. It might focus more on behaviors. So sometimes shifting behaviors will really help, including adding self-care strategies. And then other psychotherapists will work with you to examine the root causes behind some of the feelings and thoughts that you're having, maybe based in childhood experiences or trauma. The therapist partners with you to explore your emotions, thoughts, and behaviors and to find new ways to think, feel, and act. And then for some folks who don't respond well to either the medication or psychotherapy or a combination, may benefit from brain stimulation therapy. That's used for severe depressive episodes that don't respond well to medication when rapid relief is needed. And the way I will often put it to clients is that, it could be some hard work and take some dedication to work through what you need to work through in psychotherapy. It's very valuable and important work. But if you're in a deep depression, it can be very difficult to summon the cognitive energy and even the physical energy to do the work of therapy. And if you fall in that category, it may make sense to use a medication prescribed by your doctor to kind of give you the tools you need and the energy you need to lift yourself to a place where you can actually do the work that therapy requires. There are some strategies that may help prevent depression, lessen its impact, and promote healing, though it is important to note that clinical depression generally does require treatment, either therapy or medication or a combination, to get better. But for those who've experienced clinical depression in the past, it's important to know their triggers and the symptoms of major depression, and to watch out for early symptoms so that they can get assistance quickly to address those symptoms. You might also want to consult your doctor before discontinuing therapy with an antidepressant medication, even if you are feeling better. It's not at all uncommon for us to hear that a client has discontinued their medication because they felt better, they thought they didn't need it anymore, but actually the reason that they're feeling better is the medication. And so it really makes sense to talk with your doctor before discontinuing, and the doctor will help you come off the medication in such a way that you won't experience symptoms of adjusting to all or nothing medication. And then to enhance your resilience, practice good self-care. So we're going to talk a little bit about building resilience. We're going to talk about a 5-part model for building resilience. It starts with managing your physical energy. So what I mean by that is attending to the needs of your biology, of your body, by practicing good sleep hygiene. So some points to consider there are it's healthiest to develop a habit of going to bed and getting up at the same time 7 days a week, especially if you're really trying to establish a nice sleep routine. You may have to commit to that sort of regular schedule for a period of several months to really establish good habits. It's good to, as many of you will already know, it's good to stay away from computer and phone screens for an hour or two before you go to bed because of the kind of light they emit, but also because of the way they stimulate your thinking and kind of get your mind working and maybe attach you back into anxieties that you've experienced a little bit during the day. So setting up a regular bedtime routine and discontinuing screen and practicing some kind of calming activity for the hour or two before you go to bed. It's a good habit if you're worrying kind of about something and you find that that worry comes back to you in the middle of the night. A helpful practice can be setting some time aside in the late afternoon or early evening to actually very deliberately worry about the thing that is on your mind. So the best practice for that is to set a timer, to commit yourself to thinking through whatever that worry is for about 15 minutes. And when the timer turns off, you're going to write down the worry on a piece of paper and put it in a box. And then you put that away for the day. And if you can do that several hours before bedtime, it will clear out some of the worries that can really emerge in the night. So good sleep hygiene is important. Eating healthy foods, establishing a regular exercise routine, being aware of the effects of medications, alcohol, and other drugs on your physical well-being, including the quality of your sleep. So we do know that while it may seem that alcohol helps us fall asleep, it actually will wake us up 2 or 3 hours after we fall asleep, and then we'll have a disrupted sleep cycle. So it's not a good approach to sleep. And then engaging in creative and joy-inspiring activities is another way to kind of take care of your body as well as your mind. And then focusing on your thoughts, it can be very helpful to practice gratitude on a daily basis. So locating one thing to be grateful for every day, at least one thing, writing it down can be very helpful. And then also thinking about what is within your power to control in any one moment, and focusing on actions that you can take in that moment, and letting the things that are, at least for now, outside your control stay to the side, because what's the point in ruminating about them, because there's nothing you can do in the moment. These are some of the skills, by the way, that a therapist can really help you learn, practice, and maintain. And then focus on seeking solutions rather than becoming mired in the problem. And so it can be very helpful to vent about the way we're feeling by talking to a friend or writing in a journal about our worries and fears and sadnesses. But it's very important and helpful to kind of keep those that venting somewhat limited, so that you're not just recycling the same thought and sort of like digging the wheels into the mud deeper and deeper because of the spin of the wheel. And so once you've expressed it once, if you can then do a very conscious mental shift to solution seeking, that can be very helpful. Facing negative information without dwelling on it is related and very helpful as well. It is important to acknowledge painful feelings and experiences, and then again, noticing when you're just sort of rehashing and rewinding and just kind of going through that continuous loop. Learning to step out of that continuous loop is a very valuable skill as well. Practicing emotional intelligence can be helpful. That means learning to acknowledge and express your emotions. And some of us were blessed to be raised in families where emotions were not judged, but were identified and expressed in an appropriate way. Others of us were not, and even as adults, we need to go back and learn. We can really benefit from learning to be very specific in identifying our own emotions. So instead of just saying I'm in a good mood or a bad mood, sort of figuring out, do I feel fearful? Do I feel sad? Do I feel lonely? And being able to acknowledge those emotions is very helpful. Just the fact of acknowledging and identifying and labeling the emotions actually gives us a little bit of space between us and the emotion and sort of unhooks us a little bit from the emotion and gives us some more choice with what we do with the emotion. And then empathizing and providing support to others can also be very helpful. It's very important to attend to our own emotional health, but when we empathize and provide support to others, that can increase our own feelings of well-being. We're going to talk a little bit more about that in a bit. So how to go about acknowledging emotions. Here's a technique called the NAME technique for acknowledging emotions. The N is for noticing the emotion. Let's just take a moment to notice any emotion that may be welling up in us right now. And then just silently label that emotion, acknowledge that emotion by name. And then make room for the emotion. So get a sense that your mind is opening up and that emotion is in there, but it's got space to sort of expand and dissipate and float through your awareness. So you expand your awareness and that emotion can float and shift and evolve. So that technique, the NAME technique, is not about feeling better. It's really about allowing yourself to experience whatever emotion arises without criticizing or judging yourself or trying to hold it back. Now let's talk about the power of empathy. When we empathize with others, our bodies produce calming hormones that help us feel better. So it can be very helpful to our own mental health to learn and practice active listening skills. When you're practicing active listening skills, you're fully present for your friend. You're pressing pause on giving advice and judging. You're just being fully present. So you're not jumping ahead to a solution. You're allowing yourself to stay present with whatever the emotion is in the room and not jolt away from it. Empathy builds connection with others, and connection can protect against depression and can contribute to healing. So focusing on your purpose, values, and strengths can be important. Very often our mind will get attached to a relatively small fear or worry, And it can help us sort of expand our awareness by thinking about an overall purpose, the values and the goals and the strengths that we have. It can help to forge and maintain connections with a diverse network of friends, relatives, and colleagues. And that is true for introverts as well as extroverts. So extroverts may need a whole lot of friends and a lot of activity. Introverts may need a few. But as long as you're forging and maintaining those few valuable connections, it can be very helpful to your well-being. Loneliness is definitely a risk factor for depression. And then expressing yourself with words, conversations with your spouse or a partner, conversations with friends and colleagues, or expressing yourself in writing through journaling or blogging, producing art of some kind, needlework, painting, drawing, play. Some of you may be aware that there's a bit of a resurgence of coloring books for adults. That can also be very relieving. And then physical outlets, including walking, yoga, and dance. Now I'd like to talk a little bit about my organization, the Faculty and Staff Assistance Program, and what we do. The Faculty and Staff Assistance Program is the internal EAP for many of the entities of Johns Hopkins, the university, Johns Hopkins Hospital, Bayview, Johns Hopkins Community Physicians, and many other entities of the health system. We don't, at this point, serve Sibley or Suburban or all children's, but those entities do have their own EAPs. And so what I talk about when I talk about FASAP is going to be somewhat similar to what you would get from your own EAP. So please contact your HR department if you're in an entity that FASAP doesn't serve to connect with your own EAP. So our services here at FASAP are free. It's a benefit that you receive as a member of our Hopkins family, and they're confidential. So they're accessible to all Hopkins staff and faculty, as well as members of their household 16 or older. We do see children here at FASAP, but we very often work with parents who are concerned about their children and help connect their children with resources in the community, therapists, and treatment providers, and other resources in the community. FASAP clinicians are master's level licensed mental health professionals, licensed professional counselors, and licensed clinical social workers. And so at FASAP, we help employees address a range of concerns that are listed here. It is certainly not the case that you need to feel like you have a diagnosis of depression to come in and see us. In fact, in our role here, we're not treatment providers, and if we assess somebody to meet criteria for a mental health disorder, we will connect them with a treatment provider in the community. But what we do, in addition to a very thorough assessment, is we will do short-term counseling when appropriate to support somebody through a rough patch at work or at home, through a period of grief and loss, through transitions, through relationship difficulties, through communication problems at work or at home. And then when somebody needs treatment, we will work to get them connected with very good treatment providers that we know in the community. So the bar for using our services is very low, and we just encourage people to use our services when they need some support to get them through any kind of difficult situation. Our locations include the East Baltimore Medical Campus, Bayview, Johns Hopkins at Eastern, and we also do see clients in Columbia, Glen Burnie, and Washington, D.C. And there's our phone number and our email. And actually, we're accessible 365 days a year, 7 days a week, 24 hours a day at that number. And when we're not here at the office, we have a service of master's level clinicians that take the call, so you can always reach a counselor. So we've talked about self-care quite a bit in this webinar, and so I thought I would end with a little bit of meditation, breathing. So if you have a moment to spend with us, please do. So if you can either stand or sit in a comfortable position with your feet flat on the floor, and you can just let your arms rest on your lap or on the arms of your chair, and have your back just gently elevated without being rigid. And just let your shoulders drop away from your ears. And just focus on whatever parts of you touch the chair, the backs of your legs, your feet on the floor, your hands resting on the arms of the chair or your lap. And just focus on dropping into those spaces where you connect with some other surface. Your eyes can be closed or gently downcast. And just breathe normally. Don't shift your breathing in any way right now, but just observe the rise and fall of your breath. Whether the breaths are long or short, shallow or deep, even or uneven, just observe your breath rising and falling. Now we're going to do some focused breathing. I'd like you to breathe in on a long count of 7 through your nose. Hold your breath for a count of 7. And then exhale for a count of 8. And then let's breathe in now, this time for a count of 4. Hold your breath for a count of 7. And exhale for a count of 8. I'm going to do that 3 more times. Inhale for a count of 7. Hold the breath for a count of 7. Exhale for a count of 8. Inhale. Hold. Exhale. And one more breath. Inhale. Hold. Exhale. And feel the seat, the back of the seat support you. Let your breath just return to the normal rise and fall. Now just open your awareness to sounds in the room. Connecting into this present moment through sound. Are there continuous sounds, percussive sounds? Are there layers of sound? Very good. Now gently bring your palms together and rub your hands together. And if your eyes were closed, open your eyes and bring yourself back into the room. All right, I think we have time for some questions, Liz?
Yes. So we will encourage anyone, if they have a question, please utilize the chat feature here. We will be filling some questions here. And just as a reminder, we will not be recording the questions in the answer section, excuse me. So we will be stopping the recording now.